Hello everyone, now let us discuss about anatomy of musculoskeletal system, shoulder joint. So what is shoulder joint? Shoulder joint is a ball and socket joint formed by head of the humerus and glenoid cavity of the scapula. It is a ball and socket joint formed by the head of the humerus and glenoid cavity of the scapula. It is also referred to as humeroscapular or glenohumeral joint. Now coming to the anatomical components of shoulder joint. It is composed of following components. The first one is articular capsule. It is a thin loose sac that completely envelops the joint and extends from glenoid cavity to the anatomical head of the humerus. It is a thin loose sac that completely envelops the joint and it extends from glenoid cavity to the anatomical head of the humerus. The next is coracohumeral ligament. It is strong, broad ligament that strengthens the superior part of the articular capsule. The next is glenohumeral ligaments. These are three thickenings of articular capsule over the anterior surface of the joint. They play a role in joint stabilization. Glenohumeral ligaments, they play a role in joint stabilization when the humerus approaches or exceeds its limits of motion. The next is transverse humeral ligament. It is a narrow sheet extending from the greater tubercle to the lesser tubercle of the humerus. It functions as retinaculum, which is nothing but the retaining band of connective tissue to hold the long head of bicep brachii muscle. Transverse humeral ligament, it functions as retinaculum to hold the long head of bicep brachii muscle. The next is glenoid labrum. It is a narrow rim of fibrous cartilage around the edge of the glenoid cavity, which slightly deepens and enlarges the glenoid cavity. It is a narrow rim of fibrocartilage, glenoid labrum. Now coming to bursa. Bursa is a sac or pouch of synovial fluid located at friction points. So shoulder joint has four bursa. They are subcapsular bursa, next is subdeltoid bursa, next is subacromial bursa, and next is subcoracoid bursa. Now here you can see the diagrammatic representation of shoulder joint. This is the humerus bone and this is the tendon of biceps brachii muscle. And this is the scapula. And this is the articular capsule. Whereas this, the blue color one, is the subcapsular bursa. This one is the coracoid process of the scapula. And this is the superior transverse scapular ligament. Whereas this is the trapezius ligament. Whereas this one is the conoid ligament. And this is the clavicle. And this blue color one here is the subacromial bursa. And this one is the coracohumeral ligament. This is the coracohumeral ligament. And this one is the glenohumeral ligament. Whereas this one is the transverse humeral ligament. Now coming to the movements of shoulder joint. The shoulder joint has more freedom of movement than any other joint in the body. This is an important point. Shoulder joint has more freedom of movement than any other joint in the body. And this freedom results from the looseness of the articular capsule and the shallowness of the glenoid cavity in relation to larger size of the head of the humerus. And the strength of the shoulder joint results from the muscles that surround the joint, especially the rotator cuff muscles. So there are four rotator cuff muscles. They work as a group in order to strengthen the shoulder joint. They are supraspinatus, infraspinatus, teres minor and subcapsularis. These are the four rotator cuff muscles that strengthen the shoulder joint and are responsible for the strength of the shoulder joint. Now coming to the various movements the shoulder joint can perform. It can perform flexion, which is nothing but decrease in the angle between articulating bones, usually in the sagittal plane. Extension is nothing but the increase in the angle between the articulating bones, usually in sagittal plane. The next is hyperextension, which is nothing but extension beyond the anatomical position. Next is abduction. Means away. AB. The root word AB means away. Movement of bone away from the midline, usually in the frontal plane. Next is adduction. AD means towards. So movement of bone towards midline, usually in frontal plane. Next is medial rotation. Rotation is nothing but movement of bone around longitudinal axis. Whereas medial rotation means towards the midline. Lateral rotation means away from the midline. Movement of bone around its longitudinal axis away from the midline. The next is circumduction. Circumduction is nothing but whenever flexion, abduction, extension, adduction and rotation are performed in succession, then it is circumduction. So these are the various movements that are performed by shoulder joint: flexion, extension, hyperextension, abduction, adduction, medial rotation, lateral rotation and circumduction. Thank you for watching. Please subscribe for further videos on anatomy and physiology.